Hi, this is Joy Levinsky. I'm web manager for the Christopher and Dana Reeve Foundation, and I'd like to welcome you all to our monthly web chat with Dr. Dan. You may ask your questions using the chat box in the bottom left of the web portion if you are signed on through the web portion. If you have called in, you are more than welcome to speak out loud. I'm going to urge you all to speak, and hopefully those on the computer have a microphone and listening through the speakers as well. Definitely want participation, so I'll be watching that chat box for questions. And I'd like to get us started with Dr. Dan today because our hour goes very, very fast. So I'm going to turn it over to Dr. Dan to give us a heads up on what he'd like to start the conversation with as he typed his question in the chat box. Hi, Dan.
Well, that's the deal. You know, Julie, I've been talking a lot about the value of hopelessness and how hope can actually be a curse. And the gift of hopelessness is this, that when we can give up hope for changing our history or making today be the same as it was yesterday or whatever it is, but as long as we have hope for, something like that, we're going to be miserable. Julie, I had a friend, still do have a friend, and her hope is to find this amazing man. And of course, she's not going to find an amazing man. Everybody's got flaws in them. So she's been very unhappy in relationships since I've known her, and this goes back many years. And I've had people I went through rehab with over 30 years ago that said they had hope back then that they would walk again. And they sat home and just waited for the cure. And, that's not living a life. And I encourage them, that hopelessness often helps you live the life you have. Well, then I did a radio show on hope, and someone challenged my definition. And hope is more of a plan. If you want to accomplish something, how are you going to accomplish it? That way, you take more of an active role in your life instead of waiting for the miracle or waiting for anything to happen. You take an active role in your life, so you're no longer powerless, but you're more in charge of your life here. So that's my thoughts. But Julie, these conversations go wherever they go. One of my thoughts was, Father's Day's coming up in a couple of weeks, and what does it mean to be a father when you're in a wheelchair? What does it mean to be a man when you're in a wheelchair? We just passed Mother's Day, and those very same questions. So, look, we can take this wherever you like, and whatever you want or need to talk about today, I'm open for it. So, David Daniels writes, I just read that your wife died on May 5th. How do you cope? He goes on to say, I have lost the love of my life and soulmate, and also a quad who was injured in 1980. Well, first of all, David, my wife didn't die on May 5th. That was the anniversary of her death. And coincidentally, her favorite holiday was Cinco de Mayo, and she died on that day. And she died after she left the marriage. And it was an ugly, ugly divorce. But as she was dying of complications from MS, I just grew to love her all over again. And yes, when she died, I lost someone I loved very much, and someone I always had loved since the day we met. And how did I cope? I don't know if I have any answers to that, David, but I do know this, that what matters is how we all cope with the lives we have. David said she passed away a week ago of a heart attack, and yes, she was very fearful, but she was wonderful. And how do we cope? You know, I love to look at trees, David, and you know the real beauty of trees when you look at them? None of them grow perfectly erect. You know, they all bend and have branches coming out, and you know, all of them change direction based on scarring of the tree. You know, an assault, a death of a limb, and that's their beauty. And when we lose someone we love, I believe it leaves scar tissue on our soul. And it's right in that scar tissue is where the memories are. You know, those memories are sometimes anguish, and sometimes warm, and sometimes loving. How do we cope? We cope our own way, but my God, we cope. We cope. Sometimes we cope against our will even, you know, but we do. We've got this thing called a life force in us. And, you know, I talk about how after my accident I had to make a decision, or I wanted to make a decision about whether to live with this or to take my own life. And, you know, ultimately I decided that I was going to live with it. And the main reason I decided, not because I'm a hero or strong or a good father or husband at the time, I chose life because I wanted to live. And that's what we do. You know, we're assaulted, we're knocked down, we're heartbroken, and we choose life. You know, there's something inside of us that chooses life. You know? It's not pretty, it's not easy, but we choose life. So, I hope that answers your question. I hope it helps. You know, we suffer when a loved one dies because we loved them. I was at my companion's daughter's graduation, and the chaplain gave comments to the class, and she was a very heartfelt, wonderful woman. And as she began talking to these students, she began to cry. And somebody said to me, "Why is she crying? I mean, she goes through this every year." And I said, "She's crying because she cares. That's why we cry, because we care, because we love." And I don't know about you, David, or anyone else who's lost a loved one or lost something we love. You know, we cry because we care. We cry because we love. And the deeper the love, the deeper the pain. So I sure hope that was helpful. I got a comment from Jason. Jason said, "The way I cope with hardship or loss may be a bit different than most. Being T3 para, I've had to take the focus off me and focus on how I can improve the lives of others by my interactions with them. My story, experiences shared with people can change the way they look at their current situation. Every day, I look at ways to impact someone's life in a positive way, and by doing so, I feel better. And then he apologizes for sorry for being so long. No, I am glad you were just that long. That's, well, there's tons of research that reinforce your position, that the more we are of service to others, the more well-being we will find. I'm not talking about, those who are family caregivers. You are already of service to others. But, boy, if you can devote your life, or part of your life, or at least your thinking, to making the world a better place for just another human, or a plant, or an animal, the research shows you're going to be much happier. David Brooks just published a book called, actually I forget the title, but, in it he said there's two kinds of resumes in our lives. One is the resume we work on in our careers, to make ourselves look good so we can get hired at good jobs and make more money. He said, but there's another resume, and that's the resume that people say at your funeral or your memorial service. What they say about what kind of person you were. Hopefully loving, caring, compassionate, a good spouse or partner, a good parent or son, or all of the above. And that's the resume that you're working on, Jason. And that's the resume that's going to give us a sense of well-being in this world. And ultimately, that's what we want. That's why we work so hard. That's why we pursue relationships. It's because we're looking for well-being. We're looking for a life of ease, some happiness, a sense of being connected and making a contribution to the world. And that happens with the latter resume. And you've learned that. I've learned that. And, I'm fortunate that my profession, helps me do that. So, now, your comment wasn't too long. It was just right, and I appreciate your sharing it. You're sharing it with us. Julie?
Yeah, I am here.
Good. So how do you cope with hardship? If I may ask, have you lost someone you love?
Yes. Absolutely.
And how would you describe how you've coped? Or can you?
Well, a couple of things that struck me while you were talking and answering questions as well. So, first of all, you had mentioned this. You said you were discussing hope in your radio show, and someone challenged you on your definition, which I applaud that person for actually challenging on your definition. So, and then the other thing was that you had talked about your wife passing, and then you went on to your decision to live life. You're talking about your quality of life after your accident, and talk about your companion and your daughter. And I kept thinking, boy, if you had made the other decision to leave this world, you wouldn't have met your companion. You wouldn't have seen your daughter grow up. You would have missed so much that you, personally, you probably wouldn't trade for the world. And secondly, you probably don't realize how much that means to your companion and your daughter.
Right.
So I thought those were incredibly important things. And when it comes to even coping, because this is why we have these web chats, is to hear others' perspective. Because when coping is just that, I'm listening, going, boy, you know what? I'm coping with a lot too, but if I'm not here, how am I going to enjoy the things that do come my way?
Yeah, unfortunately, we can't think of that when we're in acute pain.
Right.
You know, when we lose our function, when we lose a spouse or anyone else we love, all we can think about is ourselves. It's like when you're sick or you're in physical pain. You know, all you can think about is yourself, and you don't think big picture. I mean, Jason. Well, Jason, right after his accident, in the days and weeks, wasn't thinking, how can I help others? Or he might have been, but I certainly wasn't. But after a while, I mean, we choose life because that's what we do. I mean, 99% of us, given the choice of life and death, choose life. That's who we are. Then the question is, Julie, how am I going to live with this? And I hear that in my office. You can imagine how often I hear that in my office. How am I going to live with this? And what goes through my mind when somebody says that is, well, pay attention. I mean, you will. You'll find a way to live with this because that's what we humans do. But pay attention and you'll learn how you're going to live with it. And much of that is up to you. Much of that is your call. But has that been your experience too? Right after an immediate loss?
Yes, it is. It's. I mean, we have the stages, but it's at the end of the day, it's up to me. But the thing I value is that it's my choice. It's my choice to decide how I'm going to live every day, and to what am I going to put into it to know what to get out of it. I still like having that choice.
Yeah, well, we all do. We all do. You take choice away from us. And, depression very often ensues after that, once we lose choice. I got an interesting comment, Julie, in the chat from Maureen Armstrong. Well, not interesting, but something many of us think about and fear. Maureen Armstrong says, I'm a 57-year-old with T10 paraplegia, and my husband has been my caregiver. My greatest fear is if he dies first. And then she says, I've been paralyzed for 5 years. I wish I could have a chat with you, Maureen, because I'll tell you my MO. And Julie, most mental health professionals would not recommend this, but I've been doing this for the last 35 years. So if there's a nightmare scenario, and Maureen, you've described yours, if there is a nightmare scenario in your head, what I usually do is go there. I go to what feels like hell, and I sit there, and I find a way to cope with it, whether it's a plan or just tolerating the fear and terror, but very often it's a plan. I'm leaving for vacation, and it's out of the country, and I've got a half a dozen nightmare scenarios. The wheelchair van doesn't show up, or the airplane breaks my wheelchair, or the hotel room with the wheel-in shower, gets canceled. All these nightmare scenarios, and one by one, I've got a way of coping with each one. Now, those things certainly, Maureen, aren't as terrifying as what you are worrying about. But still, you still need the plan. So there's a real possibility that that'll happen. So what then? What then? What are you going to do at that point? That's why I'd love to be having that conversation with, about what your thoughts are, what you would do, what you could do, not what you're scared of, but what you would do when you're there. I often encourage people, when you've got a nightmare scenario, when you've got something that looks like hell inside your head, I encourage people, go to hell. And once you spend some time there, at least in your head, if and when it happens, you've got, a strategic plan. So, if you're able to, give us a call, Maureen, because I'd love to hear your feedback. I got another comment, Julie, from Jason. Oh, here, Julie, when you and I were talking about, my looking at the big picture.
Yeah.
Jason said it took about 2 years to grasp that concept about serving others. And that's about what it took me, too. It took about 2 years. So, Julie, I'm going to do some of your job right now. If anybody wants to chat on the phone, I can't do your job because I forget how to unmute.
*6 is mute, and *6 will unmute if you're already muted, but everybody's line should be open.
Okay. So if anybody wants to chat here, please feel free. David.
Yeah.
David Daniels, who we spoke with earlier, said Maureen has a great question. Is what people fear. That is why you are so great, because you have a disability and also have fears. Oh boy, David, you don't want to get into my fears. We'll be here for a very, very, very long time. But I got to tell you, all of you, that my fears, the amount of my fears, the intensity of my fears, they vary. And all of us can say that. Julie, I'll bet you can too. The number of things we fear grow and shrink, and the intensity of our fears grow and shrink, but nothing changes, really. Relationships don't change that much. People don't die typically around us. Our disabilities are the same, or the disability of our loved ones are the same. But interestingly enough, the intensity of our fears and the number of fears, they change. So what is that, you think? What is that makes them change one way or the other? Julie?
I think that you conquer one of them. You conquer little pieces of them that's what makes your dreams and fears change, because you've put one to rest.
That's an interesting thought. Well, when you put a fear to rest, I don't know about your mind, but that little space inside my mind where the fear used to be, it fills up very, very quickly.
Well, that's it. I don't think you're ever getting rid of your fears, but I think it changes because hopefully that's the way I like to think of it.
It does change, but here's why. Not because you've conquered your fear, that one fear. It changes because your brain learns that you can conquer your fear. So it's not about the fear per se. It's about how comfortable you are within your skin. And that's exactly, Julie, you helped me get to exactly where I wanted to get to with this. That on days when it's worse for me, those are days I'm just not comfortable inside my skin. That the world feels, a little scarier. That my body feels a little more fragile, but none of those things are true. And what is true is the days when it's not so bad, I'm feeling more comfortable inside my skin. I'm having more faith in my own resilience. I feel closer to who I really am and not in that nervous Nelly of my frontal cortex that tells all sorts of nightmare stories. So, I think it's where I am and what I'm experiencing on that particular day, and even in that particular moment, is the difference. Me, anyway. Meanwhile, Julie, I'm wearing my microphone from Dragon Dictate, and I accidentally turned that microphone on, and my last monologue almost got sent out to everybody. Difficult. It's difficult being a quad sometimes. Sometimes it's not as much fun as it used to be. Today it is. Today it's fine. Nobody wants to chat.
No, nobody wants. I love the comments and the questions coming in because they're really hitting on a lot of the point of what you're talking about and the actual fear. That's a reality that you keep saying about go to hell, and I don't think it seems very difficult for me to even put myself in that place.
To what?
Actually go to my worst fear.
Yeah. Yeah, well, that's why you need somebody who's willing to torment you like I am.
Thank you, Dan.
That's why they pay me the big bucks here. But really, that's my point, Julie.
Dan and Daniel just put another comment in, and as well as Jason, and I don't want you to miss them because both their comments are...
All right. I'll leave you alone.
No, go ahead. I want you to... I don't know if you can you see them?
I can.
Okay, great.
David Daniel says, Dan, when I was young and disabled, yes, I had fears. But growing older, I have more fear. Now getting older, I've been hurt 45 years. Your answer was great about fears and change. It is okay to fear. And you know what the truth, David, and anybody else listening, Julie? As I age, for me it's been 35 years. And, I'm an old guy now. It happened when I was 33, so I'm about to turn 69. And my body doesn't just feel more fragile. It is more fragile. So when I get sick now, I get sicker, and it lasts longer. And so my baseline anxiety is up. And because I feel more fragile, and that anxiety has me being more kind to myself, to my body. I'm not seeing as many patients as I once did. And I'm even, Julie, I'm telling you this for the first time, and my listeners on this web chat, that I've pretty much decided that as of next Thanksgiving, I'm going to not be doing my weekly radio show anymore. And I've been doing that. This year's the 30th anniversary of my radio show. That was a traumatic decision, the most painful decision I've ever had to make. But, it's in the service of my body, of my life. I made that decision was I wanted to live as long as I could, with as much vitality as I could. And who knows if that'll help. But boy, I want to do what I can because, my God, I love this life. You know, I love having a life. Even on its most difficult days, I can look out a window and see the magnificence of nature. So I want to prolong it best I can. So my baseline anxiety is up, and let me be the first to tell you, in case you haven't known this already, anxiety sucks, but, you know, it does have its purpose. Okay. David said, thanks, that's just what I needed to hear. All right, let's see what Jason says. Jason says, understanding that fear is false. Evidence appearing, is false evidence appearing real. I try to remember that the fear is nothing more than an undesired outcome that I'm projecting. I change my focus to the desired outcome that I'm going to achieve. What you focus on grows. So, Jason, you sound like a typical therapist. I mean, what you just said is basically what cognitive behavioral therapy is. You know, you focus on potentially positive outcomes. And fear, you're right, all fear is about the future, and all fear is about predicting negative outcomes. You're right about that. But I do want to say this. 95% of fear doesn't carry valuable information. Fear, though, does sometimes carry valuable information. Right? You wake up in the middle of the night and in a panic because you forgot to pay your car insurance bill on time. You know, that's where fear has a value. My fear about dying earlier than I want to, about losing stamina earlier than I want to, has me making some changes in my life that hopefully will enable me to avoid those fears. So some fear is valuable, and I agree with you, 95% of it is not. And I also agree with you and all the cognitive therapists out there who say, yeah, we are just focusing on a potentially negative outcome. And you know, just as good a chance that we'll have a positive outcome. As a matter of fact, the research shows that our ability to predict the future sucks. That we are no better than 50-50, if that. And that comes out of Dan Gilbert's research out in Harvard. As a matter of fact, Dan Gilbert is the guy that does those Prudential commercials, you know, where he has people put in up gold markers if they about their past, and gold about negative and blue about negative. And most people predict a positive future, but you know, it's going to be 50-50. You know, it's going to be both positive and negative, just like our past. So Jason says he absolutely agrees with that too. So I'm having a problem here, Julie.
Okay.
Everybody's agreeing with me. It just scares the hell out of me when too many people start agreeing with me. Because I don't have much experience with that. I mean, my whole youth, I remember my mother looking at me, shaking her head and rolling her eyes. So that's what I bring to the party. Everybody, all these smart, thoughtful people agreeing with me. What do you say? That's a peek into my childhood. Nobody wants to join the conversation.
It's again *6 if you want to mute, or *6 to unmute. And even if you just want to pick on Dan, that would be fine too.
Yeah, really. Really, it makes me feel at home.
Somebody disagree with him.
Yeah, and listen, if anybody who's on the line with the phone cares, I'm working my little butt off here, I don't want to work this hard. I want to have a conversation back and forth. So, Julie, while we're waiting for other comments, you there?
Yes, I am.
All right. So while we're waiting for other comments, I want to tell you what got me thinking about Father's Day and what it means to be a father with a disability. I'm working on a chapter now on an edited book. Somebody asked me to write a chapter on being a father to, when you have a disability and what that means. Now, I know we're off on a bit of a tangent here, but, I spent so many years, my girls were 5 and 6 when I had my accident, and I spent so many years feeling guilty for what I couldn't do. I couldn't teach them how to ride bicycles. And before their accident, we used to, go out and play kickball or whatever kind of ball we played. And I couldn't do that. And I felt guilty about that. And, I felt guilty about so many things that I wasn't able to do for them. And about 10 years ago, Debbie and I, my youngest daughter, were out to dinner, and, I told her this. It was just she and I. And I told her this, the feelings that I'd carried forth. And this time she cried. And she cried knowing that I suffered all those years. And, she told me that what she got from me was so much more than what she lost. Because what she got was a man who could sit with her and tell her stories and listen to her stories. Something she said none of her other friends' fathers could do because they were always so busy doing things or fixing things. And here I was, talk about being self-absorbed, feeling terrible because of things I couldn't fix, not realizing what I was bringing to the party. And I think, that's the case for all of us. We're so aware of what we've lost and what we don't have and what our loved ones are missing or what we're missing. But, we're less aware of what we have, of the gifts in the wake and of this trauma. And, my daughters have both devoted their lives to caring for the world around them. My one daughter, Allie, the oldest, she is with animals what I am with humans. She just cares passionately about their welfare, and her life is devoted to trying to diminish their suffering and making this culture more sensitive and compassionate towards animals. And my younger daughter, Debbie, she just cares for people, for the community. People turn to her. So both of my daughters, and I think as a direct result of the trauma we lived with, are more compassionate people than, who knows, than they might have been. But, I spent all those years feeling I wasn't a good enough father because I was focused on what I lost and what I couldn't have. And I guess I also bought into, like most of us, society's stereotype, about what it means to be a man, what it means to be a father. I gave a talk, years ago at Grand Rounds and at a hospital. And, the theme of the day was spinal cord injury and speaking to patients about spinal cord injury. And so I came into the back of the conference hall, and nobody really knew I came in. The audience was, all seated in front of me, and the stage was way in front. And there was a urologist that raised his hand, not knowing I was back there. And he said to the panelists, he said, I don't know how to tell my male patients that they're now a half a man. And I thought, that's what manhood means. Yeah, to have an erection and to be able to ejaculate, that's what it means to be a man. And that's part of the stereotype. We're big, we're strong, we fix things. We make love like they do on TV or on porn films or like fantasies in our heads. That's the stereotype. And like most, we buy into it. And it's, what does it mean to be a man? I think that's for each of us to define, but I don't think that's it. I don't think the ability to have an erection or to change a tire or, I don't think any of that makes us a man. I think what makes us a man is our hearts. Courage makes us a man, but the courage to do what we're afraid of often, the courage to speak our truth, the courage to take ownership of our vulnerability and not hide from it, not pretend we're different than we are. That's courage. That's real courage. So that's partly why, actually that's all of why I wanted to talk about that part. Jason, go on, Julie.
You said it's the same, what I just heard is the same thing as what your daughter was telling you about being a father living with a disability. You thought it was about, teaching her how to ride a bike, but for her it was different experiences that you got to sit with her and talk with her, and it was a different experience. So that was still being a father.
Yeah, but I wasn't aware of it.
Right.
And you know why I wasn't aware of it? Because I just absorbed the stereotype. I mean, it was the stereotype I grew up with. Yeah, all of us did. And to a large extent still exists today. What does it mean to be a man? What does it mean to be a father? The stereotype is still out there, and most of us buy into it. And it's our responsibility. We're teachers now. And, I talked about that here a lot, Julie. We're teachers. Like it or not, we're teachers. And what we teach, that's up to us. So I want to read what Jason just posted here. He said, same here, I'm a father of a 13-year-old girl. I was injured when she was 7. I felt that other dads had the ability to walk, run, hike, that they were better than me. What my daughter told me once was she had a dad that loves her, puts her first in his life, shows her that, give me a minute, I lost my place, shows her that even though there are huge obstacles in life, we are much more capable than we think. She had a dad that was present in her daily life. Well, I got to tell you, Jason, I want to see your daughter for therapy. I want her to be my therapist because she sounds wonderful. We talk about being a teacher. The world's going to be better off because she's in it. And that's part of the beauty, you know. It's not just what she said. It's that she thinks that way, that her thinking has that kind of depth and compassion in it. So she wasn't just describing what's good about you. She was also describing what's wonderful about her and how compassionate and loving she is. And I got to believe some of that is the trauma she's endured. And, you know, maybe I can't even call it a trauma, but the life-altering event that she experienced. I see an old friend of mine has joined the conversation. That's Trish. Trish and I have known each other for about, 200-300 years, I'm guessing. She's a caregiver, and we met on the Christopher Reeve webpage. And she came out here for a conference in Princeton. She lives in the Midwest, and she came out here for a conference in Princeton. And Julie, as you know, that's about an hour from where I live in South Jersey. We met there face to face for the first time, and it was great. You know, it was great putting a real life face on someone that I had grown to care about over the years. So, hi Trish. I'm assuming you're at work and can't talk, but I just wanted to give a shout out to an old friend. Jason also says about his daughter, we've had the ability to have long talks and lots of time together. We learn a lot from each other. And, Jason, I was at this college graduation over the weekend up in Providence, and one of the speakers talked about, it was a student graduating, and she talked about what she learned most was when one of her professors, a renowned person, somebody asked him a question, and he said, "I don't know." And that changed her orientation towards learning and towards her college career. That it's what we don't know that's the most interesting. That if we tend to overvalue what we know, and we undervalue what we don't know. And if we could honor what we don't know, we would make less assumptions about people. We would be better listeners. We would learn from almost everybody we encountered, because we have no idea what it's like in someone else's skin. And I say that because, of what you said, Jason. We have the ability to have long talks and lots of time together. You said we learn from each other. And you couldn't learn from each other. You couldn't learn from each other unless you were willing to be open to what you don't know about one another. If you thought you knew, you couldn't learn. So I think that's just beautiful. So I hear from my friend Trish. She said I was absolutely right. She is working. And then she says, funny, you talk about not being a good dad. I feel like I'm not such a good mom because much of my time is devoted to my paralyzed husband instead of my kids. It's hard to be on both sides. My God, I can't minimize that, because family caregivers have, I think, the toughest jobs in the world. And I'm talking about family caregivers whose family members is severely disabled, needs a great deal of care. Yeah, it is hard. It is very, very hard. Not only do our family members need care, not only do our kids need care, but we need care. I mean, the caregivers need care more than any, I don't know if more than any of them, but just as much as the others. And all of the research shows that, if we can be kind and compassionate towards ourselves and care for ourselves as though we would our own child when they were babies, if we could care for ourselves in that way, then everybody else is better off. We would have, more love in our hearts and, a little less cortisol, the stress hormone. So, and it's so hard to do, Julie. You and I have spent many hours having this discussion. But, self-compassion changes everything. And now there's a ton of research about that. Kristen Neff, who I think is just brilliant. She's probably the nation's leading expert, leading expert on self-compassion. Her last name is Neff, and it's Kristen with a K, Kristen, and self-compassion. If you just Google self-compassion, you will find her pretty quickly. I highly, highly recommend her. And Trish, it was great hearing from you, even via this context and not face to face.
I remember Trish as well. It's funny. I remember her by her community name in our community before this one. And as soon as you had mentioned about her being a caregiver, I'm like, oh, that's who he's talking about. So hi, Trish, as well. And I'm glad to see you're still a big fan.
Yeah. All right. Well, Miss Julie,
yes.
We are just about out of time. And I want to tell you and those listening that because I'm going to be out of town, I'm not going to be available. Give me a sec. I'll get my calendar up. I'm not going to be available for our next chat, I don't think, until like the 23rd of June. Let me see. Go on.
Ahead. Well, I was going to say, let's all be sure to join the community. Go to ChristopherReeve.org/Dr. Dan and leave a bunch of questions for him so we can keep him busy when he returns from his trip.
Oh, boy, would that be great. I'd really love that. Yeah, thanks for mentioning that. Okay, and Julie, you and I will talk about the exact date. Okay?
Yeah, absolutely. Well, I'm sure you'll talk about it, and I love your stories and when you get back, so I'm hoping it all goes well because the last couple of times you've had some really crazy stories, and so I'm definitely looking forward to hearing about your trip when you get back.
Okay, thank you. All right.
And I want to
go on.
No, you go ahead.
I just want to thank everybody who chimed in, especially the folks who engaged in conversation with me via these chats.